Hello, everyone. It's February the 17th. I've got an awful lot of not real good news here as far as the folks that we've lost. Some of these are reconciliations, but this number is 123 additional deaths that we have in West Virginia now. Now we're up to 6,146 folks that we've lost. So just bear with me, and while I'm reading these, please understand wholeheartedly that we're not just going through this motion just to be going through the motion. I hate it like crazy, but at the same time, these people deserve our respect, our honor, and please share that in prayer for all these folks. The 6,024th death is a 58-year-old female from Cabell County. The 6,025th death, an 83-year-old male from Hancock County. The 6,026th death, an 81-year-old male from Cabell County. The 6,027th death, an 81-year-old male from Clay County. The 6,028th death, a 74-year-old female from Jefferson County. The 6,029th death, a 58-year-old female from Lincoln County. The 6,030th death, a 66-year-old female from Monongalia County. The 6,031st death, an 87-year-old female from Grant County. The 6,032nd death, an 81-year-old female from Cabell County. The 6,033rd death, a 62-year-old male from Greenbrier County. The 6,034th death, a 93-year-old male from Braxton County. The 6,035th death, a 76-year-old male from Mingo County. The 6,035th death, a 76-year-old male from Mingo County. The 6,036th death, an 87-year-old female from Wood County. The 6,037th death, a 65-year-old female from Marion County. The 6,038th death, a 55-year-old female from Jefferson County. The 6,039th death, an 82-year-old male from Wayne County. The 6,040th death, a 72-year-old female from Kanawha County. The 6,041st death, a 53-year-old female from Putnam County. The 6,042nd death, a 72-year-old female from Marshall County. The 6,043rd death, a 93-year-old male from Fayette County. The 6,044th death, a 69-year-old male from Monongalia County. The 6,045th death, an 82-year-old male from Harrison County. The 6,046th death, a 58-year-old female from Gilmer County. The 6,047th death, a 66-year-old female from Boone County. The 6,048th death, a 91-year-old female from Cabell County. The 6,049th death, a 92-year-old female from Barber County. The 6,050th death, a 91-year-old female from Randolph County. The 6,051st death, a 91-year-old male from Mercer County. The 6,052nd death, a 68-year-old male from Kanawha County. The 6,053rd death, an 84-year-old female from Roane County. The 6,054th death, a 97-year-old female from Brooke County. The 6,055th death, an 88-year-old female from Putnam County. The 6,056th death, a 73-year-old male from Putnam County. The 6,057th death, a 91-year-old male from Morgan County. The 6,058th death, a 71-year-old male from Morgan County. The 6,059th death, a 67-year-old male from Logan County. The 6,060th death, a 69-year-old female from Wyoming County. The 6,061st death, an 81-year-old female from Work County. The 6,062nd death, a 94-year-old female from Kanawha County. The 6,063rd death, a 68-year-old female from Wyoming County. The 6,064th death, a 71-year-old female from Wyoming County. The 6,065th death, an 81-year-old female from Hancock County. The 6,066th death, a 61-year-old female from McDowell County. The 6,067th death, a 79-year-old female from Kanawha County. The 6,068th death, a 70-year-old male from Kanawha County. The 6,069th death, an 81-year-old female from Mercer County. The 6,070th death is a 63-year-old female from Greenbrier County. The 6,071st death is a 47-year-old female from Work County. The 6,072nd death is a 63-year-old female from Jackson County. The 6,073rd death is a 70-year-old male from Lincoln County. The 6,074th death, an 84-year-old male from Wingo County. The 6,075th death, a 67-year-old female from Mercer County. The 6,076th death is a 73-year-old female from Cabell County. The 6,077th death is an 85-year-old female from Putnam County. The 6,078th death is a 63-year-old female from Mercer County. The 6,079th death, an 84-year-old female from Cabell County. The 6,080th death is a 54-year-old female from Kanawha County. The 6,081st death is an 89-year-old female from Cabell County. The 6,082nd death is a 62-year-old male from Kanawha County. The 6,083rd death is a 62-year-old female from Mineral County. The 6,084th death is a 96-year-old female from Berkeley County. The 6,085th death is a 95-year-old female from Tyler County. The 6,086th death is a 77-year-old male from Berkeley County. The 6,087th death is an 83-year-old female from Boone County. The 6,088th death is an 82-year-old female from Marshall County. The 6,089th death is a 69-year-old female from Putnam County. The 6,090th death is a 72-year-old male from Upshur County, rather. The 6,091st death is a 54-year-old male from Mercer County. The 6,092nd death is a 94-year-old female from Wood County. The 6,093rd death is a 78-year-old male from Mercer County. The 6,094th death is an 82-year-old female from Kanawha County. The 6,095th death is a 71-year-old female from Brooke County. The 6,096th death is an 88-year-old male from Kanawha County. The 6,097th death is a 64-year-old female from Kanawha County. The 6,098th death is a 73-year-old male from Kanawha County. The 6,099th death is a 61-year-old male from Work County. The 6,100th death in West Virginia is an 88-year-old male from Kanawha County. The 6,101st death is a 45-year-old female from Kanawha County. The 6,102nd death is an 87-year-old male from Harrison County. The 6,103rd death is an 87-year-old female from Cabell County. The 6,100th and fourth death is a 50-year-old female from Boone County. The 6,105th death is a 79-year-old female from Kanawha County. The 6,106th death is a 75-year-old male from Kanawha County. The 6,107th death is an 84-year-old female from Clay County. This is terrible. I mean, that's just all there is to it. We're going through these names of people and or these great folks from West Virginia, and it's that have given us so much. It's unbelievable, and you got people out there that are really, really hurting, really, really sad, and it's just really, really bad. That's all there is to it. The 6,108th death is an 89-year-old female from Raleigh County. The 6,109th death is a 71-year-old male from McDowell County. The 6,110th death, a 36-year-old female from Mercer County. The 6,111th death, an 84-year-old female from Jackson County. The 6,112th death, a 53-year-old male from Kanawha County. The 6,113th death, a 60-year-old male from Raleigh County. The 6,114th death, a 67-year-old male from Lewis County. The 6,115th death, a 91-year-old male from Cabell County. The 6,116th death is an 81-year-old male from Harrison County. The 6,117th death, an 85-year-old female from Kanawha County. The 6,118th death, a 75-year-old female from Hancock County. The 6,119th death, a 67-year-old female from Barber County. The 6,120th death, a 54-year-old female from Berkeley County. The 6,121st death, a 48-year-old male from Grant County. The 6,122nd death, a 62-year-old male from Taylor County. The 6,123rd death, a 66-year-old female from Randolph County. The 6,124th death, a 60-year-old male from Mingo County. The 6,125th death, a 77-year-old female from Logan County. The 6,126th death, an 86-year-old female from Greenbrier County. The 6,127th death, a 65-year-old male from Kanawha County. The 6,128th death, a 57-year-old male. The 6,128th death is a 57-year-old male from Mercer County. The 6,129th death is an 83-year-old male from Brooke County. The 6,130th death is a 65-year-old male from Boone County. The 6,131st death is a 92-year-old male from Raleigh County. The 6,132nd death is a 77-year-old female from Kanawha County. The 6,133rd death is an 84-year-old male from Taylor County. The 6,134th death is a 75-year-old male from Greenbrier County. The 6,135th death is a 66-year-old male from Nicholas County. The 6,136th death is an 86-year-old male from Ohio County. The 6,137th death is an 89-year-old female from Monongahela County. The 6,138th death is a 94-year-old male from Monongahela County. The 6,139th death is a 63-year-old female from Jackson County. The 6,140th death is a 52-year-old female from Brooke County. The 6,141st death is an 80-year-old male from Harrison County. The 6,142nd death is an 81-year-old female from Wood County. The 6,143rd death is a 64-year-old male from Greenbrier County. The 6,144th death is an 82-year-old female from Wayne County. The 6,145th death is a 72-year-old female from Putnam County. In West Virginia now we've lost 6,146 deaths. And that death is a 78-year-old male from Mineral County. My. It's terrible. We've got a dashboard issue today, and some of the data has not been updated and everything. You know, there was a power outage at the data center yesterday, which has caused this delay in receiving our numbers and everything. So the total number of that we have up there, you know, as far as vaccine numbers and hospital numbers and stuff like that, has not been updated, you know, on our dashboard right now. We do have 753 people in the hospital, 193 in the ICU units, and 112 on ventilators. I've told you over and over about the antibodies. We had 2 that were discontinued by the CDC or FDA. But there are other treatments. There's a couple, you know, there's 2 different types, you know, of antibodies that we can give you, and we have them. They're in a little bit of a short supply. We keep pushing to get more and more and more in here. But if you get sick in any way, please get tested to where we can get ahead of this and maybe get you these antibodies and save your life. You know, from the standpoint of the Guard, you know, there's no way to thank them enough. 348 Guard members that are out there now, and they're deployed at 38 facilities and doing phenomenal work, and probably that number is even a little low. But we thank them and thank them from the bottom of our heart. You know, the Biden administration is offering every household in America 4 free test kits. And you can get them by going on our COVID-test.gov line, and it'll give you instructions on how to get them. You know, you can also get free N95 masks. You can get 3 per person, and you can get those from the community health centers or our pharmacies. Just, check that out and try to get those if you think you need those. Our booster shots, this is the number one most important thing on my list and everything. The people that are fully vaccinated, we have got to get you to get the booster shot, especially people that are over the age of 50. We have now given in West Virginia 403,886 booster shots. That's nowhere close to the total number that we want to give, and we have got to just keep pouring it on that and pouring it on that and everything to where we can get those people across the finish line. The numbers are about the same, maybe a little teeny bit better. We've ticked up to 82.6% of the 50 and olders, and but the numbers are okay. We keep getting little by little better, but at the same time, we need to get better faster than what the numbers are showing right here. All the stuff on the COVID vaccine info lines up on the website, all the stuff about free testing is up there and everything. We encourage you in every way to get that free testing. Take advantage of that. We've got 159 outbreaks in our long-term care facilities. We don't have any outbreaks in our church community right now. We're down to 324 inmate cases and 6 staff cases at our corrections, and that's way, way, way down. And I salute again all the great work all those folks in corrections are doing and everything to take care of our inmates, take care of our brethren with all the staff that are there. So we appreciate you in every way. I hope we're doing better at getting the word out and facilitating and doing everything we possibly can to get people across the finish line that are renting or the landlords. So please call us. Please call us and let's take advantage of those dollars and try to get you qualified. And if we can, we'll put some more money in your pocket. But please call us. From the standpoint of giving blood, I've said it a million times, we need you to do that. We need you to step up. The Red Cross needs you really, really badly as they try to facilitate and do phenomenal stuff for West Virginians. I want to remind you again about this new program we have. It's called Jumpstart West Virginia Job Jumpstart Program. And with all that being said, our unemployment numbers are great, lowest in history, hands down and everything. But we still are trying to pull more and more folks back into the workforce and everything. And there's some out there, and if we can cut them this check for $1,500 if they get a job and they stay on the job for 8 weeks or more, maybe that'll be the little bump that gets them across the finish line and keeps them in employment forever and ever, because that's what we want. We copied the program out of Oklahoma, and it was successful there, and we hope to goodness we're going to be able to get more and more people back into the workforce. One thing I get, and I only, I laugh about it, to tell you the honest truth. I mean, there's this guy, his name's Marshall Wilson. I have no earthly clue what in the world he tries to do with his life. I mean, it's up to him on what he wants to do. Surely, we want to be respectful of that, but he ran for governor and got a whopping little bit less than 1% of the vote, and I don't know if he continues to try to humor himself, but he came out and said that basically, put out that I was going. Gosh, this is unbelievable. There's some crazy stuff that goes on here. I will promise you this, but this is top of the list. That I was going to change the rules to mandate vaccines and masks to West Virginians forever. And so please don't pay attention to the garbage. And where he got this, he just cut and pasted and copied something out of the state of New York. One thing I'll promise you, and I'll promise you this for absolute certainty. One thing you can count on 1 billion times over, and that is just this. Do you really think Jim Justice is going to copy anything out of New York? I mean, for crying out loud. You just think about what goes on in New York. And absolutely, do you think we want any part of any of that in West Virginia? So Marshall, I wish you the best, brother, and you know, and you know, and I mean this, you know, I'm going to pray for you and hope that you find a course in life that will give you happiness and satisfaction and quit this craziness. That's all there is to it. But I can promise you that our Senate President Craig Blair and Speaker Hanshaw, there's no way that they'll even I mean that they'll spend 1 ounce of thought about this. So just throw that in the trash can. One thing is really not so good, and in fact it's terrible, is we lost a county commissioner from Cabell County. Cabell County Commissioner Nancy Cartmill passed away at the age of 79. She joined the Cabell County Commission in 2003. Prior to that, she served as the mayor of Barboursville from 1993 to 2001. And there's no question whatsoever that this great lady loved her community, loved her family, loved all those around her, and she was a member of our Communities and Schools Advisory Council with the First Lady. We thank her so much for that, and I ask all, as I do so often, but I ask all West Virginians to join in prayer for a great, great, great lady that did a lot of great work in serving West Virginia, and also please keep in prayer all these great folks that we've lost, 6,146 folks. So that's all I got right now.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Good morning. And following up with what the governor said, we see that nationally we are in the midst of a reducing number of cases from the Omicron variant of COVID-19, a reduction in the number of hospitalizations, but we are not seeing a reduction in deaths at this point. In fact, our death rate picked up again yesterday in our country, where we had over 3,000 people die with COVID-19, and that is more than we saw die in the 9/11 tragedy many years ago. And as we look at West Virginia, the governor just read, over 150 names of great West Virginians, and we recognize through this pandemic, and we recognize it immediately till today, that these deaths can largely be prevented by having people get fully vaccinated and boosted. And when you look across our country versus other countries that have comparable standards of livings and economies for their people, the differentiation is that we have vaccinated and boosted a much fewer number of our citizens than these other countries have. And that has translated to the fact that we are well on our way to 1 million deaths in our country, and certainly have over 6,100 deaths in West Virginia. And the governor reads these names every press brief. And so as we look for the next several weeks, we know that while our cases are reducing, our hospitalizations, although not as low as they were at our lowest, at our nadir, which happened right before the Delta surge of COVID-19, down to 52 people. We're still well over 750 people in our hospitals in West Virginia. We know that predictably our number of deaths is going to pick up over the next week to 2 to 3 weeks. And that's the reason why it's really important, as the governor has said every press brief, that people very much consider choosing to get boosted. And that is particularly true for West Virginians over 50 and for West Virginians over 65, because we know that the real impact of the boost related to the Omicron variant is the most beneficial in our older part of our population. So it's a real opportunity for us to prevent more tragedy in West Virginia. We have the solution, and we certainly hope that all of you who are eligible for the booster, who have gotten 2 doses of the vaccine, will choose today to go out to get the boost to protect yourself, so that you don't enter the names that the governor reads at the beginning of the press briefs in the future. Thank you so much.
All right, thank you, Dr. Marsh. Next, we'll go to Secretary Bill Crouch with the DHHR.
Good morning, everyone. As the governor mentioned, our vendor yesterday had a power outage. This is the vendor who handles our electronic COVID laboratory results. This was a system-wide outage covering 13 states and territories with all of their vendors impacted by this. Power was restored around 5 o'clock yesterday, but there were intermittent problems throughout the day and throughout the night. As soon as we obtain that laboratory data from our vendor, we will update the dashboard. But for now, the dashboard is kept the way it was yesterday at the 10 o'clock update. So stay tuned. We'll update that as soon as possible. I want to make you aware of that. Thank you.
Thank you, Secretary. And finally, to Dr. Amjad, our State Health Officer.
Good morning. Just want to give some good news. West Virginia did make it a priority for all our long-term care residents to have the COVID-19 vaccine. The CDC, the National Healthcare Safety Network, it is the nation's most widely used healthcare information tracking system. They do update that weekly. And we did have information that West Virginia is 13th in the nation. We have about 80.5% of our long-term care residents who are up to date with their boosters. So everyone in our long-term care facilities who are eligible for their boosters, 80% of them are boosted right now in our long-term care facilities. So that puts us at 13th in the nation right now. So that is good news. We do want to thank all the long-term care facilities, our Joint Interagency Task Force, and of course, everyone who does participate in giving out the vaccines. A lot of the family members often have to give consent for that. And we do want to thank everyone for those joint efforts. Thank you.
Thank you, Dr. Amjad. Retired Major General Jim Hoyer had a prior engagement and will rejoin us next week. We'll now go to questions from members of the media. The first today from Charles Young with WV News.
Hi, this is Charles Young with WV News. My question is for Dr. Marsh. I think this has been asked before, but I was hoping you could remind us, how long does the immunity boost that folks receive from the booster shot last? Thank you.
Dr. Marsh, please.
Thank you, Governor, and thank you, Charles. Well, the boost lasts a good amount of time related to protection against severe illness, hospitalization, death. But we know that the absolute potency of the vaccines are dependent on the infectivity of the variant of the virus, and the Omicron variant is by far the most infectious form that we've seen. And we know after about 3 to 4 months after that booster dose, remember the booster we're talking about here are in people with normal immune systems, where you've gotten the first and second dose either 21 days apart from Pfizer or 28 days apart from Moderna. And that 5 months after that, you've gotten another dose, a booster dose. And we know after about 3 months or so from that booster dose, antibody levels, which are the part of the immune response that neutralizes, binds to, and blocks the virus from being able to get into our bodies very well, start to reduce. And in Israel, an additional booster, that fourth booster in people 60 years old and over, demonstrated a heightened amount of antibodies after that second booster shot, and also about a 3 to 4 times increased protection and severe illness hospitalization. But the good news is that the benefit of the boost still maintains the third shot in the series for most people. And in the US, we don't have the ability right now by FDA clearance to give that fourth dose, but the third dose still maintains. When you look at spreading of infection, we see a loss of potency where we go from about an 80% benefit early in the boost to maybe a 50% benefit after about 3 to 4 months. But when you look at protection against hospitalization and death, that stays up in the mid 80% range for hospitalization and hovering around 90% for death. So still really good data suggesting that a boost makes a big difference. And we know if you don't get a boost, just have 2 doses and you're older, that benefit falls really down significantly. So that's the reason why we're really trying to compel and help people choose to get a booster if they've been fully vaccinated and haven't been boosted yet.
All right, thank you, Charles. Next to Kenny Bass with WCHS and Fox 11.
Hi, thanks for taking my question, Governor. I hope the service for your uncle went well. I've done eulogies for family members in the past, including my mom, so I know it can be difficult and tough, but all the best to you and your family with your loss. I have a question for Dr. Marsh. Doctor, what are your thoughts about, it looks like at least that many parts of the country, some even previously fairly conservative with the masks we're talking about, are doing away with mask mandates and getting back, I guess, into a normal flow of life. We just heard Kanawha County Schools a couple of days ago did away with its mask mandate. So do you think we're at a position in the pandemic, medically speaking, epidemic speaking, that that's a move that we can make safely as we continue down the path with this thing? Thank you.
Dr. Marsh, before you go, let me thank Kenny for his kind words about my uncle. Unfortunately, I've had to give the eulogy, several different times, not lots and lots, but a few times. And I can tell you that it's really odd. Normally I can get through it okay, but yesterday it was really tough. And I really attribute that to just one thing. This man was, just think about it. He played basketball at Oceana High School and then graduated from high school and then immediately was right straight to World War II. And then came out of World War II where he and two of his brothers were serving at the same time in the war. Now, and just think about it, and then came right out of there and he became a coal miner and was a coal miner his entire life. And when he retired from his coal mining profession and everything, he ran a food pantry for 39 years for West Virginians. Now I'll tell you this, and I said this yesterday, I'll never be as good a man as he was. That's all there is to it. Somebody really, really special. So Kenny, thanks a bunch, and I promise you it wasn't any fun yesterday, but I really appreciate you thinking about us. And from the standpoint of Dr. Marsh, talking about masks and schools and all that kind of stuff, I would be a real proponent of us moving forward without those crazy masks on our kids and everything. And I still think that that we need to wait on what's going to come out of the legislature, and absolutely right behind that, we also need to wait on the fact that there is some real value to the local control, but I wish to goodness we'd get those masks off our kids. But nevertheless, I don't know if that was all your question, but Dr. Marsh, please go ahead.
Thank you, Governor, and thank you, Kenny. I think the governor said it well, Kenny. We know that the Omicron surge is still not absolutely done in West Virginia, and we still see the number of people dying every day be way too high. And we still see our hospital numbers be higher than we would like them, which are down close to zero for people with COVID-19. On the other hand, I think it's been the governor's policy and our state's policy not to mandate masking at any central level, but leave that up to local control so that the local communities can act in the best interests of their citizens, that would include their children. I think that as we go forward, we are at a fork in the road related to COVID-19. And if the virus continues as the Omicron variant, and with the amount of additional immunity that we have today, both from vaccination and boosters and native infection and recovery, then we may well be starting to see the beginning of the end of the pandemic, particularly because, as you suggest, people's attitudes and behaviors are much more accepting of the consequences of COVID-19 today than they had been early in the pandemic. On the other hand, this virus has been very challenging for us to navigate, and it's always turned left when we anticipated it would turn right. So it's also going to be important for us to keep a very watchful eye as a senior leadership team, and certainly with the governor, to make sure that the virus doesn't make a different turn where we'll have new challenges. So this is a really critical time, I think, for all of us as we assess what's going to happen next.
All right, thank you, Kenny. Next to Mark Curtis with Nexstar Media.
Good afternoon, everyone, and let me also extend my sympathies to the governor's family on your loss. God bless you all. Governor, I do have a non-COVID related question today. I'm working on a profile for Black History Month. And you, of course, appointed Senator Owens Brown to his seat in the state Senate, becoming the first African-American male to take a seat in our state Senate. Why did you appoint him? What did you like about him? What do you think his good qualities are? And do you also hope this becomes part of your legacy that you appointed the first African-American male to the state Senate?
Well, Mark, here's just all there is to it. You know, and again, thank you for your kind words about, my uncle. But here's just all there is to it. I appointed this gentleman because he was exactly what I'm talking about my uncle yesterday. A good man, a rock solid, really good man. And I've had the opportunity to be around him not tons, but enough that absolutely you can see his soul and you can see what an incredible, impressive gentleman he is. So if it just happens that it goes down in my legacy that I was able to appoint, to the Senate, the first African-American male into our Senate and everything, yes, sir. I'm absolutely proud of that. But with all of that and everything, I don't make appointments on the color of people's skin. I don't make appointments, on the fact that, that they're this or that and everything. I try to pick the very, very best people for West Virginia. And this man is the best man that I could have picked. I'm really proud of him.
All right, thank you, Mark. Next to Paul Mullen with WCBC.
Good morning, Governor. Good morning, panel. Governor, some very emotional testimony during the House debate on the abortion bill. I'd like to have your thoughts on that bill, which way you may be leaning. And I know it was an overwhelming vote. How does that testimony, though, register with you? Thank you.
Well, Paul, I would say let's just wait until it makes its way to me. But you can rest assured wholeheartedly, I stand rock solid for life. I'm not going to change. I'm not going to waver in any way. And let's just wait just a little while before I weigh in with a strong opinion. But, I'm proud of what we're doing, and I'm proud that we're standing for life.
All right, thanks, Paul. Governor, I'll turn it back to you.
Okay, Dr. Amjad reported something that I didn't know, but it's important stuff. And again, this is not tooting my horn, not tooting Dr. Amjad's horn. It's tooting West Virginia's horn, and that's how we should look at it. We should look at it that way across our media. We should look at it that way across all government officials and the people of West Virginia. In our long-term care facilities, she said that those folks that are boosted, the rate is at 80.5%, and that ranks us 13th in the nation. Now, we want to be first, but absolutely in West Virginia, where we know you got a lot of people that listen a lot of times to the social media stuff and everything where they say, there's tracers in this vaccine, and if you take this vaccine, they're going to know where you're at and this and that, and crazy stuff that social media bombards us with. And to be perfectly honest, in West Virginia, we fall victim to that a lot, don't we? But for us in West Virginia, to have people boosted at a rate of 13th in the nation, that's pretty daggum good. So let's just keep it up, and we'll keep working and try to get to first. But 13th in West Virginia, with the bombardment of all these just absolute silly things that people post on social media that scares people. And then they develop hesitancy. And then they say, well, I got a lot going on in my life. I'm going to pass on that booster thing right now. And then before you know it, it ends up really bad. So I'm really proud of these folks. And I know a lot of people put in a lot of the licks, to get our long-term care folks, vaccinated, and those that are working to get that done and achieving that. I've always said over and over, don't confuse effort with accomplishment. You're accomplishing. So good job. Now, Dr. Marsh, I think, was talking about the third shot and the value of the third shot, which is your booster, and what a profound impact it has on lessening your probability of death or lessening your probability of hospitalization. Now remember, you're talking to a guy right here that's surely the ripe age of a problem. And I'm surely carrying around a pound or two that I shouldn't be carrying around. And all of a sudden, boom, I've got COVID. Now, I got pretty daggum sick. And in fact, for a couple days, it was really sick. Not good at all. Now, with all of that, though, the whole time, I really felt like, first and foremost, prayers to God above that everything was going to be okay. But I felt like, I'd been vaccinated and I had been boosted. And I thought this would pass, and it did. I didn't end up in the hospital, and I surely didn't end up with dire circumstances beyond that. But with all of that being, absolutely, I believe without question, those vaccines and that booster shot kept a really, really potential bad outcome from happening to me. So, Dr. Marsh tells you how much it improves your probability of good stuff versus bad stuff with the third shot, which is your booster. Now, from the standpoint of what West Virginia is trying to do, for those folks that are over the age of 50, and I think that's the way we sent it up, we're trying to follow advice from Israel because they have so much good advice in regard to the fourth shot. The fourth shot, we tried to get permission on our elderly that had been boosted to give them the fourth shot. We haven't gotten that yet, but we're going to still keep trying because the information on the fourth shot shows a prolonged effectiveness that's really good. So the third shot makes you a whole lot better. The fourth shot would make you even better, but absolutely, if you are just vaccinated, well, first of all, go back. If you're not vaccinated at all, you're probably making a big mistake. We're going to be respectful of your wishes, but absolutely, we're probably going to tell you that that's not probably, you're probably making a mistake. But if you've chosen to be vaccinated and you don't have your booster shot, that's not good. That's just plain not good. So nevertheless, good news from Dr. Amjad. I appreciate Dr. Marsh and all this great stuff, and conveying stuff. Dashboard went down a little while. Those kind of things happen. We appreciate, Secretary Krause and General Hoyer, all these experts that come on and talk to you all the time. And let's just keep pulling the rope together, West Virginia. We're getting through this. We hate like crazy these folks that we're losing, but at the same time, we got to just keep going north. That's all there is to it. We just got to keep pulling that rope together, and we'll get through it. We'll get through it. Thank you so much.